These are the recordings of the slides C and D of chapter 13 we didn't get to in class. So mostly they focus on the spinal nerves. We covered the cranial nerves in class. So starting with slide set C, you do need to know, remember we learned that there are 12 pairs of cranial nerves. Well, you need to know there are 31 pairs of spinal nerves and they are all mixed. The cranial nerves, remember, they are mixed except for the first two, which are the olfactory and the optic nerves. Now, I'm going to skip a lot because I'm trying to cover this in just one recording, and there's not as much information on the exam from the last two sets of slides on the spinal nerves, but there is some. So I know I've mentioned this before, but every spinal nerve has a ventral root and a dorsal root, and the ventral root contains motor fibers or efferent fibers, and dorsal roots contain sensory or afferent fibers. So here's an image of how it looks. Whatever nerve is coming in to attach to the spinal cord, the dorsal or back posterior root of it is going to be I can't think. The dorsal root is going to have the sensory fibers, and then the ventral root, which is the anterior side, the front side of the spinal cord, closest to like your stomach and your face. The ventral root is going to have the motor or efferent fibers. Okay, so I'm going to skip a little bit here. All right. I do want you to understand that each muscle of your limbs, arms and legs, each one of your muscles is innervated by more than one spinal nerve, so that damage to one doesn't cause paralysis of that muscle. Okay, so I know there's a question about that. Now, the cervical plexus, going back to, I didn't really highlight this, but I do want you to know, the cervical plexus, there are 8 cervical nerves, and the cervical plexus is C1 through C4. So the C1 through C4 form the cervical plexus, and most branches from the cervical plexus form the cutaneous nerves. Remember, cutaneous refers to skin. So the cutaneous nerves innervate the skin of the neck, ear, back of the head, and the shoulders, and other branches innervate the neck muscles. One nerve that I want to highlight from this group is the phrenic nerve, and this one innervates the diaphragm, which is your major breathing muscle. So the major muscles for breathing, particularly the diaphragm, are innervated by the phrenic nerve. And here you can see the phrenic nerve, and it's arising from, it looks like it arises from C3, but I'm not for sure. But anyway, this is the phrenic nerve in this picture. And if I don't highlight it, you don't have to know it, but this is also interesting. Hiccups are caused by irritation of the phrenic nerve, which causes spasms of the diaphragm. So that's what hiccups are. Then we have the brachial plexus, and the brachial plexus consists of C5 through C8, so the last cervical nerves, and then the first thoracic, which is T1. And these nerves innervate the upper limb. So a few that stand out that we're going to mention are the musculocutaneous nerve here, and then the median and the ulnar nerve. The radial nerve is on the thumb side. The median is in the middle between the radial and the ulnar. So the ulnar is on the pinky side, radial is on the thumb side, and the median is in the middle. So the musculocutaneous, that's basically saying muscles and skin, innervates the biceps brachii muscles and the brachialis. Also, a muscle that we didn't really talk much about, the coracobrachialis, and the skin of the lateral forearm, so the side of the forearm, the outside of the forearm. That's the musculocutaneous. Now, the nerve that is damaged when someone has carpal tunnel syndrome is the median nerve. When the median nerve is compressed, we see that in carpal tunnel. And then the funny bone is the spot where the ulnar nerve rests against a bone structure called the medial epicondyle of the, I believe it's the ulna. But anyway, it's where when this nerve is, when you hit this nerve, which is, on the outside of your elbow, it makes the little finger tingle and it hurts. It causes pain, right? So the ulnar nerve is what we know as the funny bone. All right. Then there is the lumbosacral plexus. And this is going to be the 5 lumbar nerves and the 5 sacral nerves. And the lumbosacral plexus mostly serves the lower limb or the legs, but it also innervates the abdomen, pelvis, and buttocks. So the lumbar plexus is L1 through L5. The sacral, well, actually, maybe just L1 to L3. And then sacral plexus is L4 to S4. And I do want to highlight the sciatic nerve, which is the longest and thickest nerve of the body. It innervates the hamstring muscles, the adductor magnus, and most of the muscles in the leg and the foot. And it is composed of 2 nerves, the tibial nerve and the fibular nerve. So that is the sciatic nerve. And sciatica, you may have heard of that condition. It's a common condition, and it's characterized by stabbing pain radiating over the course of the sciatic nerve. And here's a picture, by the way. Sciatic nerve is right here. So it kind of originates at the hip and then travels down the back of the thigh and branches into the common fibular and the tibial nerve. Okay, so sciatica is characterized by stabbing pain radiating over the course of the sciatic nerve. An injury to the sciatic nerve could be caused by a fall, herniated disc, or a badly placed injection in the buttocks. All right, now we are going to go to slide set D. That was C. This part of the recording is going to cover slide set D for chapter 13, and mostly it's going to focus on reflexes. So I'm going to skip some of this information. Reflex activity. All right, so you do need to know the components of a reflex arc are the receptor, the sensory neuron, the integration center, which is going to be the central nervous system, the brain and spinal cord, and then the motor neuron and the effector. So you have the receptor, which is the site of the stimulus action. So it receives the stimulus, whatever that is. The sensory neuron, which transmits the impulse that was generated from the stimulus, transmits the impulse to the central nervous system. The integration center is the central nervous system, brain and spinal cord. Then there is a motor neuron that conducts impulses from the central nervous system to the target organ called the effector. And the effector is the muscle or gland that responds to impulses. So we have a few reflexes that we're going to cover. And we're going to skip some of this stuff because it explains it. Now, the stretch reflex is, for example, the knee jerk reflex is a stretch reflex. If you go to the doctor and the doctor hits your knee with the little hammer, the stretch reflex causes you to jerk your knee, But the reflex is actually a protective type thing, and it keeps your knees from buckling when you stand upright. So that's the purpose of it, and that's why the doctor checks for it. Now, the patellar reflex or knee jerk reflex, in the patellar reflex, the stretched muscle, which is the quadriceps, when you stretch it by hitting the tendon, the patellar tendon with the hammer, it stretches the quadriceps muscle. Quadriceps is really a group of muscles, but you know what I mean, the thigh muscles. So that stretched muscle contracts after it's hit with the hammer. It contracts after that tendon is hit with the hammer. The quadriceps contract and the hamstrings relax, and that is called reciprocal inhibition. The quadriceps contract and the hamstrings, which are the antagonistic muscles to the quadriceps, they relax when the quadriceps contract. That's reciprocal inhibition, and you see that in stretch reflexes, like the patellar reflex. Now, and here you can see what I mean. Okay, so I said patellar tendon. I'm sorry. It's actually the patellar ligament. It connects the patella or the kneecap to the tibia. And so it's connecting two bones. That makes it a ligament. So the patellar ligament is hit with the little hammer, and that stretches the quadriceps muscles. And then it causes the reflex is that the quadriceps contracts and the hamstrings relax. And that's the reciprocal part of it, is that the hamstrings relax when the quadriceps contract. Then there is a flexor or withdrawal reflex, and those are initiated by painful stimuli, and they cause the automatic withdrawal of the threatened body part. And that can be like there's a survival function to that. Like if you know you're about to get a finger stick, you can pull your arm away, jerk your arm away. There is a reflex, a particular type of flexor reflex. It's called a crossed extensor reflex. And this reflex happens in weight-bearing limbs, and it helps us to maintain balance. And what happens, for example, is, let's say that we walk barefoot and we step on a piece of broken glass. The damaged leg is going to withdraw, but at the same time, the opposite leg is going to extend to support the weight of our body. So this keeps us from falling, okay? And then if someone grabs your arm, that causes you to flex the arm that's grabbed, and the opposite arm extends. So the function of that is to, again, help you maintain your balance. So this is an example of a flexor reflex, and specifically it's called a crossed extensor reflex. And what you can see happening here is that with the right leg, the person steps on the broken glass, they contract the quadriceps and lift up that leg away from the broken glass, away from the pain. And then on the other side, the extensors, which are going to be your quadriceps, I'm sorry. So those are, I said this wrong. Okay. In the leg that steps on the broken glass, the extensors are inhibited. So the extensors is the quadriceps, and the flexors are the hamstrings. So it's the hamstrings that contract, And then in the opposite leg, it is the quadriceps that contracts to bear your body weight so that you don't, so your leg extends and holds up your body so you don't fall. Now, there's also the plantar reflex. That the way that you stimulate that is you stroke the lateral aspect of the sole of the foot. So you stroke the outside bottom of the foot. And what the reflex is that you flex your toes downward. But if there's damage, then you will show the Babinski sign, which is when your hallux or big toe will dorsiflex and the smaller toes will fan out. This is in other words, you'll stick up your big toe. It'll point upward. This is normal in babies less than 1 year old because their myelin sheaths haven't formed yet around their the axons, so they don't have the coordination. But after the age of 1 year, they should be showing the plantar reflex and not the Babinski sign. And that is it. That's all I have for this slide set D.